Hi everyone, this is Dr. Sophia Beecher of letter U, Smile Family Dental Practice in Linstead, St. Catherine, Jamaica. This is the kickoff of our video series for 2022, and we're going to start with a bit of a controversial topic. Are we the right dental home for you? Now, I had two patients on the very same day who related to completely different dental experiences. And the only difference that I could find is that they had, one, a difference in expectations, and two, their approach to dental care was totally different. So the most important question you need to ask yourself is, what are you expecting from your dental experience? Are you looking for the cheapest? Because I can tell you that if you're looking for the cheapest, we may not be the best place for you. If that is your only thing that's a priority for you, we may not be the best place for you. However, if you're looking for a combination of value for your hard-earned dollars without cutting any corners in terms of your health or safety, then we are definitely the right place for you. Also, you need to ask yourself, what are you hoping to get out of your dental experience? Because if you come and you say, hey, I just want my teeth cleaned, you are diminishing your patient experience, because the most critical information that is disseminated happens during the interview or the examination. Okay? So we have found that patients who come and do an examination, they may have issues that they never knew they had. So the most common thing that I see is patients, they have periodontal disease or gum disease, and I am the first person to diagnose them because they clean their teeth every 6 months, and I don't know, maybe they don't ask for an examination. All right, maybe the person who cleans their teeth is not a dentist either. Okay, and they have periodontal disease when they come and they see me, so they complain about bleeding when they're brushing. They complain about maybe blood on the pillow. They also complain that when they do their cleanings, their teeth don't feel properly clean, and that's because they need more than just a gloss over or a regular cleaning. They need a full workup, and they may need deep cleaning and, you know, other things. Okay, so examination is critical. We use the examination to diagnose oral health issues. All right, we talk about well, for me personally, I go over patients' medications to see if you're complying with them. All right, that's a very important aspect of things for me, because remember, we are health professionals. We need to make sure that it's safe to do your dental treatment, and there may be some medications which may require you to get a letter from your medical doctor to say that it's safe to do your dental treatment. So we go through all of that in the examination. Well, I do. And then we look and we see if you have any issues. Okay, issues such as pathology anywhere in your mouth or the head and neck region. We look and we see if you have any cavities, gum disease, impacted wisdom teeth, damaged fillings. Right. Also, if you have any stress-related habits like grinding or clenching that may be wearing down your teeth, maybe breaking your teeth. Okay, we also find out if you have any social habits, all right, that may affect your mouth. Things like smoking, things like chewing bones that can break up your teeth. You know, very critical during the examination process. We also emphasize on how to care for your mouth properly and how to prevent future problems from happening, or how to solve the problems that you have now. And then we come up with a plan to solve these problems, hopefully permanently. Okay, so basically an examination paves the way for us to diagnose what is happening with you and to outline a plan of treatment. And we use that in combination with our x-rays to design a treatment plan that is suitable to your needs and for your optimal health. So, as we just said, the next step in the process would be diagnostic x-rays. So these are recommended for various intervals based on how we perceive that you need them. You know, the usual interval is every year to every 2 years to check on several things. To check to see if you have any cavities between the teeth that we can't see. They're normally very hard to see even during an examination. To check and see if you have any damaged fillings. Also hard to see decay on the fillings during an examination. If you have crowns, check and see if there's anything happening with the crowns. Check and see if you have impacted wisdom teeth, if there's any pathology like cysts, and the list goes on. Okay, so there's also a common misconception that fillings hurt. So x-rays are very helpful in seeing if the teeth can be filled. Okay, so if the cavity is super deep, then maybe you may need something like a root canal or an extraction. You may not actually need a filling. All right, so that's where the x-rays are critical. Also, I had somebody call once and complain that we do x-rays before we do extraction. It's a standard of care. Okay, we want to make sure that whatever we do for you is done safely. And before we do extractions, the x-rays are very helpful. Again, we can see if you have any infection in the area. We can see if you have any pathology, any cysts, any tumors. We can see the anatomy of the teeth to know if it's going to be a very difficult extraction, if it's going to be a surgery, right? To see if your roots are near critical structures. Remember, we're not taking teeth out of a vacuum. We're taking teeth out of somebody with flesh and bone. You have nerves in the area. You have blood vessels in the area. You have teeth that may be close to your sinus. So if you take them out, then there's a risk for complications, and we may be able to advise you to do something like a root canal instead of trying to take out these teeth because of complications you could have after extraction of these teeth, right? So with the examination and the x-rays, as I said, we can help to do what we call a treatment plan for you. And this is helpful for you also to budget, in terms of your finances, because I'm sure you'd want to do the most critical work first, right? So it helps for you to plan properly and helps for us to plan properly. So in the same way that a medical doctor will say, hey, Mr. B or Miss B, we need to do some blood tests and we need to do some x-rays and then we need to do surgery. It's kind of the same process. We need to do a workup of you to see what your needs are so we can help you optimally. So examination and x-rays are critical. Okay? So after we have made a plan for your treatment and we execute such treatment, then we can get you into a phase where you're just coming to us every 6 months for cleaning, right? And you do your occasional x-rays. And once we do that, then you'll be happy because you won't be spending a whole bunch of money. And also you would have been educated in terms of how to have good hygiene so you will prevent future problems from happening. A lot of people who go and say just fill my teeth without doing any kind of examination or x-ray or anything, they need to understand that a filling does not prevent decay. Let me say it again. A filling does not prevent decay. What a filling does is that it restores the damaged tooth. So if you don't have good oral hygiene habits, right, then you will have decay recurring and you will forever need to keep filling your teeth. So there's a difference between one approach and the other. Our approach, the approach of communicating properly, educating properly, and helping you to improve your oral health, is one that will create longevity of structure and function of your teeth, which you don't realize how important they are until you don't have them. Okay, so we hope that this talk has found you in good cheer, and we trust that you will make this your new dental home. Have a good day.